Hi, I'm Ann Barrow McKenzie, and I'm Coordinator of College Relations for the Villanova University College of Nursing. And I'm here today speaking with some doctoral students, and they're sharing their thoughts with prospective students so they can learn more about Villanova's doctoral program in nursing. I'm here today with Jodie Szlacht, who's a second-year doctoral student. And Jodie, why don't you just first tell us what it is that you do and why you decided to pursue doctoral study here at Villanova?
I'm a nurse anesthetist, and I teach in a graduate program for nurse anesthetists in the area, and advanced studies required in my position, and also an interest in becoming a better educator and faculty member.
And what drew you to Villanova specifically? I'm sure you looked at other programs as well.
Well, I am local, and so that was a consideration. I did a postmaster's in education at Villanova, which introduced me to the faculty and the Ph.D. curriculum here, and the online component, and really the supportive nature of the faculty and the flexibility in scheduling was a good fit for me.
Mm-hmm. Can you talk a little bit more about how that distance learning format works for your life and for your doctoral life?
Well, I maintain clinical hours in the OR, and I teach part-time, and I have little kids, and so for me to be able to access coursework by not traveling was really helpful, and helped me fit the coursework into the rest of my very busy life.
Mm-hmm. And whether or not you were technologically savvy before you came in or not, do prospective students need to be worried about that, or once you get here and you're given your laptop and you're introduced to the technology, do those fears go away?
The introduction and orientation to the laptop that we're using and all the technical equipment,
Mm-hmm.
the headphones and the microphone, was great. And so really the online portion of the technology has not been an issue at all. There's helplines, there's information desks. We're connected by usually a Yahoo online chat at the same time with all of our students. And
Mm-hmm.
so if we have problems, we can contact all the other students while we're having class. So the technology really hasn't been an issue for me at all, and I don't perceive myself as being particularly savvy in technology.
You started to talk about the other students there. Could you also speak to how you bond with your cohort and perhaps students who are in other years?
Sure, our cohort has been excellent, and I think even surprisingly excellent to all of us, since we really surround ourselves with other nurses in our specialty areas. The cohort, being such a broad and diverse group, has been really, really great. All of our courses require a collaborative process between our cohort members and ourselves, and so a lot of our work is peer-reviewed constantly by our peers, which has been really helpful in the dissertation process.
Mm-hmm. And you mentioned the big word there, the dissertation. Can you explain a little bit about your research that you're doing and how the design of the curriculum moves you through that?
My research interest is high-fidelity simulation in nurse anesthesia students. We use a peer learning model in our program, and so I'd like to study if that model is effective as using regular faculty members to teach in the high-fidelity simulator. And the dissertation topic and project is started at the initiation of the program, which is intimidating at first, but after a year I'm just shocked at how much we've accomplished towards that goal, so that when we finish coursework we're really ready to submit proposals and begin the study. Mm-hmm. So the weaving of the dissertation seminars through the program really keeps us moving forward, mm-hmm. and really at an incredible rate.
And how do you feel about your development as an educator along the way also? I know you've completed 1 year, you're just starting your second.
I completed 1 year of coursework, but prior to that I had taken some education courses, and so I'm actually a little bit further along. And all of them really contribute to the whole educator or faculty member in terms of actual teaching, philosophy, theory, statistics, research. It's a combination of the research piece with the faculty piece.
Mm-hmm. And you just said the word faculty. Can you talk a little bit about the faculty here in the College of Nursing and their level of mentorship and also expertise in the classroom, be it virtual or not?
The faculty really is what made me choose Villanova. Like I said, I had completed a postmaster's in education before I started the Ph.D. track, And the faculty is an interesting combination of really pushing us to meet criteria and really achieve, but it's in a very supportive and flexible way. They're very utility, nothing seems to be wasting time, it's always very purpose-driven. And it's really been a great resources in the whole College of Nursing.
Mhm.
Okay.
Jodie, is there anything else you feel would be useful for a prospective student to know about the doctoral program in nursing here at Villanova?
I think they combine the academic piece, the faculty piece, and the research piece in a way that really makes you fulfill your potential as a student.
Great. Well, thanks for talking with us today. This will be helpful for students considering the program. Thanks, Jodie.
Thanks.